Are you unhappy about your tummy tuck results? In this video, I'll help you determine if you've had a bad tummy tuck. For more tips on tummy tuck procedures, check out our tummy tuck playlist in the link below. So what are the signs of a bad tummy tuck? Signs of a bad tummy tuck could be related to the scar tissue, could be related to the fat tissue in the area, or to the skin. So signs of bad scars could be uneven scar, significantly asymmetric, scars which can be in areas which are very visible, too high scars, or too low rather than being in areas which can be hidden. Could be signs of bad techniques in suturing of the scar. So it can be stretched, it can be lumpy, it can have signs of stitches or signs of staples. Other signs of bad tummy tuck can be related to residual fat tissue in the area, especially big pockets of fat or uneven distribution of the fat in different parts of the body, which can give irregularities in the surface. And lastly, excessive tissue, so too much skin left behind in part of the body, causing folding or residual sagging. Also, belly button deformities, misshaped belly buttons, too much scarring or too wide scar around the umbilicus. Those are also signs of badly executed tummy tuck. We try and keep the scar as much hidden as possible in the belly button and to create the most aesthetic appearance of the umbilicus. What causes bad tummy tuck results? So there are several factors. Things are related to the surgeon, things are related to the surgery execution itself. There are factors related to the patient. Factors which are related to the surgeon could be lack of experience of the surgeon, doing techniques which may be not used anymore, or not doing techniques which are more oftenly used. So nowadays we tend to do more liposuction than we used to do in the past. So yeah, surgeons who have less experience with a specific technique, they may overlook doing them. Second factor is related to the surgery itself. So removing too much skin, too tight closure of the wound can cause sometimes wound breakdown, delayed healing, or skin necrosis. Leaving behind too much skin can cause residual laxity or dog ears at the end of the scar line. Lastly, there are factors related to the patient themselves. So not adhering to the post-operative instructions, doing too much physical activities rather than light activities during the early healing process can cause wound breakdown, cause problems with the healing. Also, an important factor is smoking. So patients who smoke, it's almost certain they will get delayed healing, could get skin necrosis, bad scarring as well. So that's why it's important to adhere to post-operative instructions. How to fix a bad tummy tuck depends on the problem in there. So if there's any residual fat tissue or uneven fat tissue, then liposuction can help even that area. If there is excessive skin, then further excision of the skin, removal of dog ears can solve that problem. If it's a problem with the scar itself, then it could have scar revision, cutting the bad scar and suturing in a better way. There are also treatments to the scar itself using lasers or microneedling. If it's to do with the shape of the umbilicus, there are revision umbilicoplasty procedures which can improve the shape of the belly button. How to minimize the risks of poor tummy tuck? So the first step to avoid and minimize the risk of bad tummy tuck is start by doing your research and choosing an experienced plastic surgeon. Then in the preparatory stages of having your surgery, you need to maintain good health, have a good diet and exercise before your surgery, avoid smoking, maintain healthy diet. All of this reduces the risk of complications during and after surgery. After surgery, you need to adhere to the post-operative instructions and adhere to the follow-up wound checks and all the instructions you're given by the doctors and the nurse to look after your wound. And finally, if you have any problems, is always discuss it with your surgeon. If you need any revision surgery, then also you need to seek an experienced doctor to advise you about those problems and how to deal with them.